We can get started. Hello again, and welcome to the From Fear to Trust Community-Led Solutions to Increase Food Access in Immigrant Communities webinar. We are so thrilled to have you here. Thank you all for joining. Just want to do a bit of housekeeping before we officially get started. We have professional live simultaneous translation available. You see this slide here, I'll give you some directions. Please, everyone, click the globe on the bottom of your screen and select either the English or the Spanish audio channel. There will also be Q&A at the end. Please add any questions in the Q&A box. They'll be answered by the host and panelists. And as a reminder, everyone will be muted for the duration of the webinar. So I can introduce myself. My name is Chioma Howenstein, and I'm very grateful to be a part of this webinar today. I am the program manager at Share Our Strength, an organization committed to ending poverty and hunger at home and abroad by supporting equity and access for all communities. I work under the No Kid Hungry campaign, and that was started by Share Our Strength. And this campaign is focusing on ending childhood hunger in the US through sustainable solutions and strategies like strengthening and expanding access to programs like school meals and SNAP. On the webinar, so grateful to have with me today some of my colleagues that work under the No Kid Hungry campaign as well. We have Karen Wong, who you'll hear from next. She's the Senior Manager of Research at the Center for Best Practices, and also Mariana Joyal. She's the Senior Manager of Media and Engagement, and she'll be leading the Q&A. Here's our agenda. We'll get started with an introduction and background on public charge. Then we'll have information about the evaluation. You hear from 4 amazing grantees on our guest panel. And last, we'll have the presentation of findings and a Q&A. So what is public charge? It was part of immigration law for more than a century, and particularly matters for people who are applying for green cards. Has several considerations such as demographic factors, age, education, and health, and also whether a person has used cash assistance, such as supplemental security income, SSI, temporary assistance for needy families, TANF, as well as state or local general relief and assistance, but also Medicaid for long-term institutional medical care, like a nursing home. As far as how the rule changed in 2019, the federal government expanded the definition of public charge to include immigrants who receive assistance with housing, nutrition, healthcare, and other benefits. The policy caused great confusion and hunger for immigrant families and US citizen children. The ruling was reversed in 2021, and further protections were added in 2022, making explicit that people who receive nutrition, healthcare, and housing benefits are not considered a public charge. There was also impact on families and individuals, unfortunately. Millions of families with children were at risk. Families did tend to prioritize immigration status over their basic needs, even if that meant that they had to make more sacrifices or endure hardships. And according to the Urban Institute study, due to ongoing fears, 3 to 4 million children in immigrant families missed out on public benefits they were eligible for in 2022, meaning millions of children were unnecessarily enduring and experiencing hunger, even though the public charge rule was overturned. Now a bit on No Kid Hungry's investment and the grant. So 1 in 4 children in the United States, equating to over 17 million children, live with at least 1 immigrant parent. A majority of these children are US citizens, with many of them and many kids being mixed status households. Given these different circumstances and unique barriers experienced by these families, No Kid Hungry did consider the best path forward for taking action at the local, state, and federal levels to ensure access for food and nutrition programs for these families. Most importantly, we leaned on trusted community-based groups like the amazing 16 grantee organizations hailing from Arizona, California, Florida, and Texas, who are leading this work with a culturally and linguistically responsive approach. And before turning it over to my colleague Karen, I want to underscore that this work is critical not only for organizations who are primarily serving immigrants, but for anyone who is working in the food justice or public benefits space. So thank you so much, and I'll pass it over to Karen.
Thank you so much, Chioma. In 2022, as fears of public charge continue to persist, No Kid Hungry created this grant program to support community-based efforts to rebuild trust, get food resources to community members, and connect eligible families to programs. So a total $1 million in grant funds were distributed amongst the 16 community organizations, which predominantly serve Latino and immigrant communities. In order to connect grantees with one another and document their important efforts, learnings, and successes, we also invested in a participatory evaluation. We partnered with the Leah Zallman Center for Immigrant Health Research on this evaluation. Having learned about the center's previous research on public charge and children's medical care, we were very excited to collaborate with them. So with that, I'll hand it over to Sharon at the Leah Zallman Center to share more about their group and the evaluation.
Hello, everybody, and thanks for joining, and thanks, Karen, for that introduction. My name is Sharon, and I'm part of the evaluation team, and I'm representing the Leah Zallman Center for Immigrant Health Research today, known for short as LZC. LZC partners with immigrant leaders, advocates in the community, policymakers, and others to conduct actionable research that promotes the health and well-being of immigrant families and communities. We emphasize working in partnership with communities and hold ourselves accountable to these core values that you can see here on the screen: collaboration, equity, joy, rigor, impact, and generosity. Next slide. Chioma and Karen acknowledge the vital role of community-embedded organizations when it comes to providing direct assistance and engaging with immigrant families. Here on the screen, you can see the logos of the 16 organizations throughout the 4 states that partnered with us closely in this work. We also partnered very closely with the other No Kid Hungry staff here on the call. We just want to pause and acknowledge the work, the time, the experience, and everything that these organizations shared with us throughout the process. And thank you guys for joining us here as panelists on the webinar or as attendees in the attendee panel. So thank you so much. And we learned so much from you and are honored to have done this work with you. Just as an example of how we worked in partnership, this here is the model that we use to guide our evaluation process. And as you can see, you have on the left the strategies being used by the different community organizations and the outcomes on the right in blue. Advance, please. So initially, we had put together a logic model as a team at LZC, and it had a handful of strategies on it. But we realized after communication and conversations with the grantees at several meetings that we needed to add many, many more strategies. And I've highlighted here in stars some of the ones that you're going to see and hear more about in the upcoming parts of the webinar when our grantees and my colleague speaks about some of the outcomes. Next slide. And finally, here's the outcome side of the logic model. Initially, we only had 3 outcomes on our logic model, and we brought it to the grantees, and they told us, you're a little bit off base. We do a lot more than that, and we're hoping to get a lot more out of this work. So we added a bunch of other outcomes, specifically those starred here. We added outcomes related to increased trust, accurate stories, the idea that there's not a single story, the importance of narrative and narrative change, and the importance of community empowerment. You can advance. So, so it's much better for you all to hear from the grantees themselves. So I'm going to pass this back to my colleague, Dani, and she's going to introduce 4 of our incredible grantees who are going to share some highlights of our work. I do want to say that we will be sharing, we only can touch on a few points during the webinar, so please consider checking out our report We'll be dropping the link in the chat, and thank you so much.
Thank you, Sharon. Hello, everybody. I'm proud to welcome our 4 panelists today. Thank you all for being here. It's been an honor for our team at the Leah Zallman Center to work with you over the course of this study. We are eager to learn from your knowledge and expertise in your communities. I'm going to introduce all of the speakers before I begin asking them questions. There will be time afterwards for a moderated Q&A session. So please use the Q&A function to send in your questions as you listen to the speakers. Rosie Bailey is the project director for the Bridges to Health program for Hispanic Services Council, or HSC, based in Tampa, Florida. HSC has a vision of creating communities where Latinos are educated, healthy, prosperous, and engaged. The Bridges to Health program builds the capacity of local community members to serve as a bridge, linking underserved community members with health information, social services, and other partners to improve health disparities. These community health workers, or promotores, are the solution to address many of the social determinants of health that negatively impact the Latino community. Marissa Calderon is the Associate Director of Family Empowerment at Chicanos por la Causa, or CPLC, in Arizona. CPLC is a 54-year-old multi-state nonprofit agency that is committed to empowering and advocating for vulnerable communities across 6 states. CPLC provides an array of comprehensive social and economic development services that also includes an advocacy and political arm through its CPLC Action Fund. Founded during the Civil Rights Movement by a group of students, CPLC also had Dolores Berta and Cesar Chavez leading boycotts to address inequalities in Latino communities. CPLC responds to the changing needs of the community from infants to seniors, and while services are offered to all people, regardless of ethnic background, CPLC has a special competence in serving the Latino community and has become the most recognized and trusted provider of services to Latinos in Arizona. Elsa Gonzalez serves as the founder and executive director of Proyecto Vida Digna, or PVD, in San Benito, Texas. We're looking forward to learning more about what Elsa is seeing on the U.S.-Mexico border. Since 2014, PVD has provided support to hundreds of undocumented migrants and their families. Elsa and her small team work to improve the quality of life for low-income families in South Texas by empowering these families to gain new skills, share their voice, and grow their power. Our 4th panelist is Marlon Portillo, the Popular Education and Curriculum Coordinator of the National Day Labor Organizing Network, or NDLON, based in Pasadena, California. Launched in 2001, NDLON was formed as a grassroots, immigrant-led collaboration of community-based organizations and worker centers, all dedicated to the mission of improving the lives of low-wage day laborers. NDLON's membership consists of more than 70 community-based organizations across the country. NDLON member organizations operate Radio Jornalera, a community-based radio network that serves as a trusted source of information for communities. The network has 7 stations in the United States and 3 international stations in El Salvador, Guatemala, and Costa Rica. In 2020, NDLON launched Mano a Mano, its food pantry program, in response to the need the community faced during the pandemic. Today, Mano a Mano continues to provide culturally relevant food to hundreds of families each month in Pasadena. Once again, thank you all for taking the time to be on this panel. I'd like to start by asking Marissa the first question. Marissa, Arizona is a large state with a significant number of people living outside cities. Would you talk about how you partnered with other agencies to provide referrals for services like SNAP enrollment at your community center?
Thanks for that question. Buenas tardes. It's afternoon here in my side of town. Great question. So our Chicanos por la Causa Community Center in Metro Phoenix serves adults, youth, and families. Last year alone, we were able to provide services to over 1,000 families, along with our own Chicanos por la Causa programs that provide family assistance resources like rent and utility assistance. We have the fortune to have amazing community partners statewide. This includes the ones that we've worked with in the past to be on site during high traffic times, such as our food box distribution days at the community center. So for families that needed SNAP enrollment outside of our CPLC service areas, through our established local food coalitions, we were able to connect them directly for SNAP enrollment education. During our food distribution days, we made sure community partners supported our indigenous-based approach to healing and wellness that promoted education about our ancestral foods, aligning with our own family empowerment philosophy of La Cultura Cura, or the culture cures. SNAP education included on-site food demos, nutrition workshops from our own community partners, and taste testings while the community was in line for food. Understanding how SNAP enrollment helps attain nutrient-dense foods further educated the community on the benefits of the SNAP program and how it leads to healing and wellness for adults and families, including addressing the social determinants of health. At CPLC, we feel strongly that if we do not have the resource on site, we will take the time to connect you directly to who can answer your questions and learn more about SNAP, for example. This is beyond a phone number. This is us having our community partner whom we have an established relationship with, follow up directly with our community client, and this ensures trust within our communities. Thank you.
Beautiful. Thank you, Marissa. Marlon, what are Andalon's strategies to ensure that the food you distribute to community members is of good quality and culturally relevant?
Muchas gracias. No, quisiera empezar diciendo que el programa de mano a mano se basa en la solidaridad y no en la caridad. Tomamos este propósito para ayudarnos unos a otros. Y sabemos que solo la comunidad va a ayudar a la comunidad, desgraciadamente así es, para enfrentar los desafíos y problemas que están pasando. Y creo que eso es lo que hace el programa mano a mano único. Se hace único por lo que se enfoca en la comunidad. Y al menos aquí en la ciudad de Pasadena, porque la comunidad está ayudando a la comunidad. Y mano a mano representa ese camino, es como el vehículo que responde a las necesidades de los jornaleros y la comunidad migrante. Mano a mano pues nació en base a los desafíos que enfrentaba nuestra comunidad durante la pandemia del COVID-19, como una respuesta natural a la exclusión que los jornaleros y las comunidades migrantes experimentan en todos los días. Las características de nuestro programa son exactamente las que nos posicionan para asegurar la relevancia cultural de nuestra comida. Entendemos pues las necesidades de nuestra comunidad porque somos parte de ella. Sabemos que tener un paquete de tortillas, por ejemplo, es más importante que una bolsa de pan. ¿Por qué? Pues bueno, esa es nuestra cultura y es lo que es. Dado que el centro de Pasadena es un espacio de usos múltiples en el que pasamos mucho tiempo, podemos hablar directamente con nuestros miembros todos los días sobre cuestiones útiles, sobre productos alimenticios, sobre derechos laborales. Los productos frescos como la fruta y la verdura son algo que siempre intentamos tener porque ellos lo valoran mucho. Es importante para sus recetas familiares. Es por eso que estamos creando nuevas relaciones o colaboraciones que nos permitan tener alimentos frescos y culturalmente relevantes. Permítame compartir algunos datos nada más del 2023. Distribuimos 4.572 canastas de alimentos que sirvieron a unas 15.000 personas. En total hemos atendido a 509 familias en el último año, llegando a 1.542 personas, de las cuales 426 son niños. De toda esa población del año 2023, el 70% son latinos, el 13.5% asiáticos y el 10% restante son de otras poblaciones y otras etnias. Actualmente estamos trabajando como parte de estas estrategias con Food Forward y otras colaboraciones con el programa New Connects y también del Banco Regional de Alimentos de Los Ángeles, que nos permite recibir donaciones, digamos, en tiendas como Bonds, Grocery Outlets y otras más, que no es fácil de navegar en ese proceso porque estas políticas de donaciones no siempre benefician a las comunidades. eh, Generalmente las prioridades van hacia las corporaciones cuando se trata de esas políticas. Por eso hemos creado nuestras propias políticas, donde tratamos de ser cuidadosos en lo que distribuimos y, y creamos un estándar de calidad, ¿verdad?, que beneficia a los trabajadores. Finalmente, desgraciadamente, la pandemia no se ha terminado. Sin embargo, vemos día a día que nuestra comunidad sigue sufriendo porque se han quedado con muchos gastos y las consecuencias económicas de la pandemia son devastadoras. Las familias trabajan por bajos recursos y a menudo se han quedado sin vivienda y tienen que decidir entre pagar el costo alto de la vivienda o tener comida saludable en su casa. Por último, también tenemos un representante que enrola a gente, que hace promoción, que se conoce como Outreach Enrollee del Banco Regional de Alimentos de Los Ángeles, para los programas de SNAP, de estampillas de comida, y el WIC. Lo que sigue siendo un desafío debido al fantasma de la carga pública que persiste en nuestras vidas. Casi todos los miembros de nuestro centro que han calificado están inscritos hasta la fecha de este año que pasó, van 260 miembros registrados. Y ese es el reto, siempre ser creativos y mantener la inventiva para derrotar la desventaja y la desventura. Muchas gracias.
Thank you, Marlon. Elsa, would you share about the unique strategies that PVD uses to support rural communities?
Hola, sí, buenas tardes. Primero que nada, muchas gracias por la invitación. Este, la estrategia que nosotros implementamos como única en Proyecto Vida Digna fue para que nos pudiera dar la meta que nos habíamos fijado en ese tiempo que fue el año pasado, el 2023. Primero que nada, mandamos las promotoras y organizadoras a identificar algunas áreas rurales, ya que son las más vulnerables por todas las carencias, incluyendo las carencias que incluyen el temor y la grande militarización que existe diario a diario dentro de esas comunidades. Nosotros empezamos a recorrer las calles y empezamos a tocar puerta a puerta. Estuvimos platicando con algunos de de la comunidad que encontrábamos al paso. Ellos se obtuvo mucha desconfianza debido a que siempre ha existido el temor a la militarización que diario a diario recorren sus calles. Nosotros proveemos servicios a 10 colonias, o sea, 10 comunidades cercanas al Río Grande. Y decidimos recorrer tocando puerta a puerta todos los días durante unas semanas para darnos a conocer y que ellos tuvieran la confianza de poder acercarse a nosotros y dejar que nosotros nos acercáramos a ellos. Después de algunos días y algunas caminatas que hicimos allí diario a diario, algunas personas sí se acercaron, platicaron con nosotros, nos ofrecieron darnos un poquito más de información, les dimos confianza a ellos de que nos platicaran cuáles eran los temores. Una de las cosas que ellos nos comunicaron a nosotros, que debido a varias cosas, incluyendo la falta de transportación que existe para esas áreas rurales, era la razón la mayoría de las veces por la cual ellos no salían a buscar una ayuda o pedir alguna ayuda, ¿verdad? Y saber dónde estaban, enterarse de dónde estaban los apoyos que había para la gente inmigrante. Entonces, después de un tiempo, ellos se familiarizaron un poquito con nosotros y nosotros con ellos, al cabo de que ellos empezaron a platicar con sus vecinos, sus familiares, y entonces nos dieron la oportunidad de acercarnos un poquito más a ellos. En ese tiempo que estuvimos platicando con todas esas personas, nos dimos cuenta que la falta de transportación iba a ser el motivo por el cual mucha gente no se iba a acercar hasta donde nosotros estamos. Entonces decidimos llevarles hasta la puerta de su casa una despensa básica que incluía fruta, verdura, grano, y algunas veces algunos lácteos. Entonces hicimos eso dependiendo de la familia y la cantidad de familia que vivían, las edades que tenían de 0 a 18 años, los niños de la escuela. Entonces, descubrimos que había también mucho más gente mayor que pasaba más de los 60 años y fue lo que nos ayudó a nosotros a decidirnos más por esas personas mayores de la tercera edad que no tenían cómo venir hasta nuestra oficina a agarrar esa despensa. Esa fue la estrategia que nosotros hicimos y logramos como única de llevarles una despensa básica a la puerta de su hogar para que ellos tuvieran un poquito de alimento, ya que se carecía mucho de eso. Esa fue un grande apoyo a nuestra comunidad que nosotros ejercimos muchas veces. Ellos no ejercen sus derechos o sus necesidades en este país por el temor y la carencia, como le digo, de la transportación, entre otras muchas cosas que se vive o se necesitan en las áreas rurales. Hasta el momento estamos distribuyendo esas despensas y seguimos mientras que podamos. Algunos cambios hemos ejercido desde entonces. pero la lucha sigue. Seguimos dando esos servicios, gracias a Dios, y esperamos contar con mucho más para poder ayudar toda nuestra comunidad que vive en grandes necesidades y pues no son tan como son más vulnerables, ¿verdad? Que cualquier otra persona que tiene un estatus legal pueda adquirir un apoyo o una ayuda. Gracias.
Thank you, Elsa. Rosie, we learned that hiring promotores was a key approach for many organizations. Can you share about the promotor model at HSC and how these specialists work with community members to enroll in SNAP?
Well, yes, thank you. A little bit something about our agency. Hispanic Services Council has a mission to increase access and opportunities for Latinos and to influence the systems that serve them. Now, what a better way to live this mission than by utilizing people from the community to serve in the community. Now, this is the model of community health worker, promotores. They are trusted messengers in the community that reach out to their families, their neighbors, their friends, oftentimes the most marginalized people in the community. And they provide assistance, knowledge, resources where it is needed, where people live, work, play, and pray. Now, Hispanic Services Council builds the skills of these community members to serve effectively in the community. This includes skills like computer skills, organizational skills, reporting skills, outreach skills, presentations skills, as well as the knowledge of federal programs like SNAP, Medicaid, WIC, and then local programs like the Indigent Healthcare Program from Hillsborough County, and also local food pantries and where they're located. Now, when a promotor is armed with the knowledge of what the eligibility requirements are for programs, how the process works for applications and submission of documents, they can be a saving grace for those individuals who have nowhere to turn. The system to apply for SNAP can be quite daunting and confusing for those individuals who don't speak the language or have technology skills or literacy skills. And this leads to many individuals to not even try to get help to address something like hunger that their family may be struggling with. Now, hunger is something that impacts many in the Latino community, and fear of reaching out for assistance because of the impact, true or not, on their immigration status prevents many from getting the help that they need. This is unfortunate because many Latino immigrants work hard in the fields to get food on the table for you and me. Many of our promotoras have the same lived experience as the people they're reaching out to help. They too were immigrants or farm workers. They too struggled with food insecurity. Now, our Latino community is very diverse, and so are our promotores, like Velia and Liliana, who are from Mexico, Veronica, who's from Peru, Rebecca, who's from Puerto Rico, and Robert, who's from Cuba. Communicating with a diverse population is important, and we ensure that we're reaching individuals with information they can understand by first running it through our promotores. Information is very powerful, and when we arm the promotores with up-to-date, accurate information, they can effectively inform the community and assist them to get the help they need, whether it be a SNAP application or referral to a local food pantry, or both. The promotores truly serve as a bridge of information so that people can make informed decisions.
Thank you, Rosie. Now I'd like to remind everybody that there will be 10 minutes for Q&A later. Our team is monitoring the Q&A chat, so please feel free to ask the panelists your questions via the Q&A function, and we'll get to them later. Now that you all have gone and spoken one round, we're going to make this more of a lightning round so that we have time for the questions and answers later. So Marissa, I'd like to circle back to you. What changes have you seen in your area in response to the recent influx of asylees, refugees, and other migrants?
Yeah, we've experienced between 15 to 20% influx of adults coming to the community center in need of work, food, housing, and other emergency assistance resources. It's basically the basic needs. This means that we're also being asked to support adults and that are parents. Thankfully, the community center offers a free after-school enrichment program that provides healthy, nutritious meals through our designation as a food bank that includes a kids cafe program. For our food bag weekly distribution days, we had people in line as early as 2 hours before the distribution begins. We also noticed that people are traveling from further outside of our general serving zip code to access a produce bag. This had created a bigger need to find funding in order to expand and sustain this distribution through this influx. On the other hand, Chicanos por la Causa, or CPLC, has a robust refugee and asylum program that is regularly available to support this population that will receive what we call a gentle transfer of services and support through our Refugee Workforce Development Department. The community center is an empowerment hub of services that initially was a barrio cantina over 30 years ago, if you can believe that. With the call and protest from the community, it now provides the services that these vulnerable families need, such as adult education courses like ESL, English as a Second Language, free digital literacy courses for job skills development, and emergency assistance flex funds for those that qualify. Thankfully, our trained personnel are used to the waves of migrant populations, as empowering vulnerable communities are pretty much the wheelhouse of Chicanos por la Causa. As demand and the community informs us, we will adjust services to meet the needs. Thank you.
Thank you, Marissa. Elsa, given your proximity to the US-Mexico border, how have immigration policies and the overall political climate impacted PBD's work?
Pues imagínense, con la cercanía que tenemos con la frontera con México, pues ya se imaginarán el impacto que está teniendo nuestras comunidades aquí con todas esas políticas de inmigración que están por concluir. El impacto que estamos viendo en nuestras comunidades es demasiado alto. El temor que día a día se vive a causa de la militarización no solo impacta a las familias que no tienen un documento legal para vivir en Estados Unidos, sino también a todas nuestras comunidades que por tiempo, ya sea ciudadano residente, no importa, han agregado de alguna otra manera a una persona sin un documento, ya sea porque sus hijos se casaron con una persona o están viviendo con una persona que no tiene un documento, cualquier otro familiar, ¿verdad? Que en este caso pues se mira mucho aquí en la frontera. Cuando no se tiene una documentación válida, pues de por sí es el temor de salir a la calle, de llevar a las escuelas a sus hijos y todas esas cosas. Las leyes nuevas que están ahorita por concluir, como el HB3 y el HB4, son unas leyes que pues nada más de oírlas ya tienen el temor, ya sienten el temor y incluso nosotros, aunque tenemos un estatus legal migratorio válido para estar aquí, nos llena un poquito de temor por la amenaza que se está viendo en nuestra comunidad hispana. Eso va a depender mucho si esas leyes se hacen efectivas en este próximo mes que estamos de febrero y marzo. Pues eso sería, va a depender mucho de un oficial, ya sea el policía de la ciudad, estatal o sheriff, no importa, cualquier persona va a poder detener a una persona y poder hablarle a migración para ser investigada. El impacto que nosotros estamos viendo, pues es bien grande, ya que esas leyes están atemorizando mucho, ya sea porque puede haber deportación, multas o las dos, incluso a una persona que tiene aún una residencia es una amenaza, ya que pues no va a poder uno darle como dice, un ride, ¿verdad? A una persona, a una clínica, a una tienda por el temor de que sea detenido por alguna oficial, o muchas veces la patrulla fronteriza está en las calles, patrullando en las calles de nuestras comunidades. En veces están paradas en la entrada o salida de esas comunidades y eso pues afecta mucho más, creo, en la educación, ya que al estar la patrulla fronteriza en la entrada de una colonia o de una comunidad, y hay personas que no tienen un documento legal, pues automáticamente no mandan a sus hijos a la escuela por 1, 2 días, 3 días, dependiendo lo que ande la patrulla fronteriza alrededor de sus hogares. Entonces, eso está afectando demasiado la educación. Ya no solo se está sintiendo el temor de salir a buscar los alimentos, de salir a buscar un apoyo, sino también de salir a buscar la educación, y principalmente está obstruyendo la educación de todos esos niños en nuestra comunidad. No es fácil la labor que estamos tratando de ejercer en la comunidad, porque el temor es mucho, pero nos estamos haciendo presentes, estamos dándoles a conocer los derechos que tienen, no importa si tienen un documento legal o no. Se les está dando el apoyo y el conocimiento de lo que pueden hacer y no pueden hacer. Entonces, pues sí, pues es bastante el temor que hay. Pedimos el apoyo de toda la comunidad y de todas las personas en la oración para que esas dos leyes no sean efectivas y no vayan a perjudicar mucho más a nuestras familias hispanas aquí en la frontera.
Thank you, Elsa. Rosie, would you share about how building HSC's relationship?
I think
Buddy, do you want to switch back to the other channel? Thank you. Rosie, would you share about how building HSC's relationship with the Florida Department of Children and Families has impacted your ability to serve families?
Very well. Well, partnership development is very important to do the work we do and to reach a wide audience. No one organization can do it all, and Hispanic Services Council relies on relationships with community-based organizations, government agencies, schools, and more importantly, funders to reach more people. It's important that DCF, the Department of Children and Family Services, have community-based organizations like ours as partners to help them with some of the burden they have of assisting individuals to apply for federal programs like SNAP. Hispanic Services Council does not receive any funding from DCF for that assistance that we provide. Instead, we rely on funding from organizations like No Kid Hungry, the Florida Blue Foundation, Unidos US, and even our county, Hillsborough County. Organizations that value the work of local community-based organizations like ours, who are oftentimes doing the heavy lifting of reaching the most marginalized people in our communities. Now, being a partner of DCF is key so that we have access to training and information regarding things like changes to the system outages, local events, and resources. When changes happen, as they often do with federal programs, the community is often unaware and confused as to what happened with their benefits. In addition, when changes happen to the systems that they utilize to apply for services, they are also left unable to handle some of those changes. The Florida Department of Children and Family Services recently rolled out a new system for SNAP and Medicaid applications. Had we not been a DCF partner, we would not have known in advance and been able to train and prepare our promotores for the onslaught of calls that this change has caused. In addition to the training and preparation the partnership with DCF gives us, it also allows us to reach individuals at DCF when we are experiencing issues with applications or for those difficult cases with many complexities. This relationship with DCF staff allows us to resolve questions with clients faster than had a client called DCF themselves. It is important to note that the relationship government agencies make with organizations like ours who have promotor programs are really a win-win. We can take some of the load off their shoulders. This is especially beneficial now at a time when many government systems are overburdened and understaffed. So if any of you would like to understand more about the community health worker model, the promotor model, and would like resources on how to implement programs like ours, I would suggest that you visit NACHWA, the National Association of Community Health Workers website. I encourage you to become a member, and if you do, please support our NACHWA ambassador, Rosa Veronica Ortiz, when you sign up and they ask you how you heard about NACHWA. Supporting organizations like NACHWA and organizations like ours really can benefit so many in the community. Thank you.
Thank you, Rosie. My last question is for Marlon. Endelon runs a successful radio station, Radio Jornalera. What is the impact of this communication platform on your advocacy and community engagement work?
Bueno, gracias, Dani. En la incidencia de Radio Jornalera, me gustaría hablar rápidamente de qué hacemos. Radio Jornalera juega un papel fundamental en la defensa de los derechos laborales y migratorios de la comunidad jornalera y está comprometida con lograr que las comunidades y personas excluidas sean protagonistas de los espacios radiales y televisivos. Por lo tanto, los principios fundamentales de Radio Jornalera incluyen: el cambio viene de abajo hacia arriba, desde abajo se defiende a todo el mundo. Nada sobre nosotros sin nosotros, y solo el pueblo salva al pueblo. Algunos aspectos destacados en las estrategias de esta plataforma de comunicación popular en el trabajo comunitario son que podemos trabajar en diferentes programas que tenemos. Y lo fundamental es que la radio misma salió de la comunidad. La radio nace por medio de la comunicación del pueblo, fundado por líderes jornaleros de diferentes países en el Centro de Jornaleros de Pasadena, California. Los líderes comunitarios sin experiencia previa en comunicación se convirtieron en comunicadores populares, compartiendo información auténtica y relevante de su comunidad. Y esto se volvió un network de networks, una red de redes. Y eso porque hay necesidad de proceder con la inclusión y el empoderamiento de la gente, en la que involucramos directamente a los miembros afectados por la discriminación, las injusticias laborales y los abusos de derechos humanos, facilitándoles que cuenten sus propias historias. El proyecto brinda espacios para empoderar a la comunidad, fortaleciendo la solidaridad y combatiendo las narrativas dominantes. Educación popular y desarrollo de liderazgo. Todos nos juntamos 3 programas, el de educación popular al que pertenezco, y con esa visión y misión que tenemos en la radio, nos centramos en desarrollar el liderazgo de la comunidad migrante, porque es la única manera en cómo la comunidad de clase trabajadora se va a liberar, a través de una educación popular liberadora. Entonces buscamos informar, educar y fomentar la unidad y la solidaridad entre las personas para construir poder y cambiar la realidad. En concreto, Radio Jornalera destaca a los trabajadores y sus luchas, elevando esas luchas para convertirlos a ellos y su liderazgo en agentes de cambios de manera organizada. En cuanto al proyecto de carga pública, entonces creamos toda una estrategia novedosa que se acercara a los medios sociales, a los nuevos retos en las tecnologías, en las comunicaciones. En nuestro proyecto de carga pública, entonces utilizamos las plataformas digitales como Facebook, Instagram y nuestros sitios web. Ahí les van a compartir los links o los enlaces, como para crear contenido educativo como videos, viñetas o cartoons o historietas o paquines y programas de radio. Nuestro contenido llegó a más de 36.300 personas nada más el año pasado y fue redistribuido en redes en Houston, Boston, Nueva Jersey, Washington, D.C. y Centroamérica. Porque tenemos 8 radios comunitarias a nivel nacional e internacional. También reproducimos nuestro contenido 36 veces durante nuestro programa de radio de voces jornaleras, llegando a un promedio de 950 personas cada vez. En total distribuimos el contenido de carga pública durante 9 meses y seguiremos haciéndolo, pues alcanzamos más de 40.000 personas y pretendemos llegar a ese mismo número o más en el tiempo por venir. Básicamente es lo que hemos tratado y seguiremos tratando de hacer.
Wonderful. Thank you, Marlon. And thank you, Rosie, Marissa, and Elsa. And now I'd like to pass the time to my colleague at the Leah Zallman Center, Benjamin Goldberg, to share key findings from the study you did with No Kid Hungry, these amazing speakers, and the other community-based organizations that participated in this public charge initiative. Ben, over to you.
Great, thank you so much, Danny. So yeah, I will now be going over some of the high-level findings that came out of our evaluation. We can only cover a snapshot of what we learned in this webinar, so we encourage you to check out the full report. We will drop the link in the chat again at the end of the webinar. So on this slide here, we are showing some of the impacts of this grant related to food distribution. The impacts were in two main areas, so the amount of food and also outreach and navigation of public assistance like WIC and SNAP with families. Next slide, please. We also wanted to learn more about the strategies that grantees were using to increase food security for immigrant families, and we identified 5 effective approaches, which you can see here. I'll just mention a few of them that rose to the top. So firstly, providing trust-based and low-barrier services through activities like food box distribution and farmers markets, and just having personal conversations with community members built relationships and trust between staff and community members. Another important strategy I want to highlight is meeting immigrant families where they're at, which looks like providing meals at school for children to take home or delivering food directly to people's homes. These approaches are useful, especially for those that are geographically isolated or that face transportation barriers. And one more strategy that I'd like to talk about is engaging with community members in culturally and linguistically responsive ways, which involves offering fresh and culturally familiar food to immigrant families and connecting them to garden projects to meet their cultural and dietary needs. Next slide, please. So this quote here speaks to how one organization offers culturally responsive foods to immigrant families. It says, "I think this is one of the only, if not the only, organization that I know that actually really caters to a specific community in regards to the food that they give. They really go through the work of putting together bags for Hispanic families that they know they're going to eat all of these ingredients and all of these foods that they're getting. They do the same for the Asian community, and they do the same thing for different communities." Next slide. So we also wanted to understand the kinds of strategies that organizations were using to move immigrant families from a place of fear to trust in enrolling in public benefits like WIC and SNAP. So we identified 5 key strategies, which are listed here. And I would like to highlight a couple, the first of which is reinforcing culturally responsive practices. So providing services in immigrants' primary languages, offering bilingual educational materials and trainings, and hiring staff with similar lived experiences and backgrounds all increase levels of comfort and trust among community members. And I'd also like to echo what Rosie discussed earlier about promotores. So involving community-embedded promotores or community health workers in grantees' work is a significant way that organizations connect with immigrant community members and build trust. Since promotores often speak the same language as community members, share the same values, and also have similar lived experiences. So on the next slide here, there's a quote that speaks to how promotores break down barriers for immigrants and allow them to feel more comfortable accessing resources. It says, "That's the #1 strategy we use. We sometimes co-locate the promotora at a food pantry, at family resource centers, at community centers, because 1, it gives the promotora access to different individuals where they can promote programs like the food stamp program, WIC, things of that nature. It breaks down those barriers for people, especially immigrants, to feel comfortable with going to some of these established organizations or government facilities." So on the next slide here, I will now be highlighting some key recommendations that we have emerged from our evaluation. Narratives around poverty and immigration can have an impact both on how immigrants are viewed and how immigrants view themselves. Narratives around scarcity, characterizing people as either deserving or undeserving of support, and sending the message that needing support is something to be ashamed of, are intertwined with the public charge rule change and other policies. Long before the public charge rule change was implemented, immigrants began disenrolling from benefits, and in spite of reversal, many have chosen not to enroll or re-enroll. So we suggest funding for regional and national campaigns to counter the very loud and well-funded messaging promoting these negative narratives. Next slide. So another recommendation is to expand programs and policies that strengthen local food access and trust building. We heard that the need to offer additional sustained funding to community-based organizations doing this type of work is even more imperative now because COVID-era funding is drying up, there are rising food prices, and there are stressors on the food system like climate change, so things generally are more challenging. Not only is more funding more important, but ensuring that funding is flexible and unrestricted is key. So on the next slide here is a quote that speaks to the importance of additional funding. It says, "I hate the fact that we call everything emergency food benefits because we've been in a 40-year emergency. We saw during the pandemic what happens when government funds the needs and people are like, okay, I'll go, and no one felt this is bad. because everyone needed it and they just went, and there was money for it and poverty levels changed. And on this slide here, we have our last recommendation, which is about evaluation and measurement. So often outcomes are dictated by funders, academics, or other outside entities. Through participatory or community engaged evaluation, the indicators that are meaningful to the community emerge. So we recommend focusing measurement on the things that matter to those doing the work and those that are impacted by the programs and policies. In this project, we heard that what matters most are outcomes like the number of families fed, but also intergenerational upward social and economic mobility and movement towards self-sufficiency. Another aspect of the work was not only the number of appointments or enrollments, but how the work was being done, as all of the others have talked about. So do the demographic characteristics of your staff match those who you are serving, and how are you meeting the needs for language access? Finally, we recommend adding in indicators of power building, policy, and narrative change. Again, we encourage you to check out the report to learn more, and now I will pass it over to Mariana, who will lead the Q&A.
Thank you so much, Ben, and thank you to the amazing speaker panel for sharing so much today. As a reminder, as you have heard, please continue to use the Q&A button to submit any questions you may have. We have received some, and some have already been answered. So I'll start with the first one. Mary Porter, can you, coming from Mary Porter, excuse me, can you speak to messaging that your organizations use to mitigate fear around the public charge? What is some of the effective language that you use to communicate this? And if possible, I'd like to start with Rosie. And if anybody would like to follow her lead or thoughts and would like to share, that would be wonderful.
Well, as I had mentioned before, the most important message is the truth, right? And so when we arm the promotoras with the true information, who's impacted by public charge, who isn't, and they can pass those messages on to the community members, that's really where the best message that we can give. One of the big things, a lot of individuals that the promotoras encounter, they may not have legal status, but their children are. And so that important message that you're not the one who is receiving the benefit, your children are receiving that benefit. And they are, legal citizens or, of the US. That's where the message lies, to really inform them what is it they are applying for, who's applying for it, and the impact that they may have.
Thank you, Rosie. If nobody else in the panel would like to chime in on this, oh, go ahead, Marlon. Go ahead.
Sí, el reto es muy grande porque una de las cosas más difíciles de vencer es el miedo. Y eso existe ahí, está todavía ahí. Y la gente pues ha sido a veces manipulada y cuesta. Entonces por eso nosotros empezamos a crear la estrategia que usamos. Igual que Rosy, ¿verdad? La comunidad es muy inteligente, lista. Ellos entonces trabajan como una unidad familiar. Y ese es más o menos el enfoque. La otra cosa que, agregando lo que dijo Rosy, es que también nosotros trabajamos con promotores de salud y con promotores comunitarios. De hecho, la coordinadora Nancy Torres es una promotora comunitaria del programa Mano a Mano, es la directora del programa. Entonces eso le ayuda a ella a ver las cosas desde un punto de vista de familia. Eso es bien importante. Y la otra cosa es la multiculturalidad. Se ha logrado crear entonces en Mano a Mano un ejército de 300 personas voluntarias de las high school, de las iglesias. Y eso es lo que hacen las promotoras, ¿verdad? Y eso es lo que hace que las familias jornaleras entonces cojan la confianza y el hecho de que no podemos trabajar solos. Eso es fundamental, porque la gente se ve acompañada y ve la fuerza a través de los números y del amor que se le da en el proceso.
Muchísimas gracias, Marlon. Y precisamente recalcando el esfuerzo sobre el que compartes y la importancia de estos recursos como el apoyo a los promotores. Tenemos otra pregunta para todos nuestros panelistas sobre cuáles son algunos recursos que necesitan para continuar el trabajo que realizan apoyando a su comunidad. Esta pregunta se la podemos traer en primer lugar a Elsa y luego podemos escuchar de María y también de Rosy y Marlon.
Bueno, el mayor apoyo que siempre nosotros hemos tenido es la falta de recursos, la falta de apoyo económico que nosotros tenemos. Ya hemos estado en la comunidad desde el 2014 y siempre ha sido para nosotros un reto encontrar los fondos necesarios para apoyar a todas esas familias que tienen la necesidad pues de todo, ¿verdad? Carecen de todo. Hasta aquí están nuestras oficinas. Nosotros tenemos personas que acaban de cruzar la frontera y vienen sin ropa, sin zapatos, vienen sin un lugar donde pasar la noche. Para nosotros y específicamente para mí es bien doloroso, es triste ver que nuestra comunidad está careciendo todos esos beneficios que cualquier otra persona pudiera tener y ellos no lo tienen y nosotros no se lo podemos otorgar muchas veces por la falta de fondos. Yo muchas veces he pensado que para mí ha sido bien difícil encontrar los fondos y poder haber sobrevivido ya casi estos 10 años como organización, pero solamente Dios sabe todos los esfuerzos que he hecho por buscar fondos, por poder ayudar. Ahorita nosotros tenemos registradas 450 familias que están viniendo a recibir una despensa por mes. Y lo que yo hago específicamente es buscar los fondos con mi propia familia, con mis propios hijos, con mis propios hermanos, sobrinos, todo. Entonces de allí estamos sacando mes tras mes el pago para dar ese apoyo a la comunidad con esa despensa diaria, perdón, esa despensa una vez al mes. Entonces, para nosotros como Proyecto Vida Digna, sí es triste, es ver cómo nuestra comunidad carece de lo más esencial, que es un pedazo de pan, una tortilla, por la falta de recursos. Ese creo que sería nuestro primordialmente búsqueda, apoyo y que solicitaríamos el apoyo financiero de otras organizaciones.
If we are almost at time, Marisa, if you want to make it very short and quick, would love to hear just a brief couple thoughts, and then we are getting ready to wrap it up.
Lo que iba a decir, I'll say it in English. In addition to funding that we need collaborations. I always say, I can't do everything. CPLC cannot do everything. Using our promotoras, using our community partners, scheduling and coordinating so that we're not duplicating services. Just the word of mouth from our community, if another church or some organization wants to help, I say competition is out, collaboration is key. That's the only way that we're going to help everybody.
Funding and collaboration, loud and strong words. Thank you so much, Marisa, and thank you to all. I'll pass it back to Chioma to wrap us up.
Thank you, everyone. I know we are at time, but before we conclude, I do want to give a heartfelt thank you to everyone who made this webinar possible. Amazing colleagues at Share Our Strength No Kid Hungry, the Leah Zallman Center for Immigrant for Health Research, the amazing contributions of the 16 grantees who participated in this evaluation, these awesome 4 grantees who shared their expertise and the way they approach this work to address food insecurity in Latino and immigrant communities, And a big thank you to you all for joining, for supporting, for your engagement. Truly appreciate it. The executive summary and the final report will be sent out to you all in English and in Spanish, as well as this recording that will be shared in the Q&A. And please remember that if we truly want to end hunger in America, it is key for anyone in the food justice space to employ the strategies, the culturally and linguistically responsive strategies that you heard previously and that you'll read in the report to best reach immigrant communities. So thank you once again, and I wish you all the best.